In Australia, 57% of the population now use some form of alternative medicine. In the year 2000, Australians spent $2.3 billion on alternative therapies, a 62% increase since 1993. The integrative medicine industry is growing at a phenomenal rate, and Dr. Vera's pure innovation is at the forefront of product development. In 2005, 9,723 adverse drug reactions were reported. How many of your patients do you know have reacted to excipients? Although many of these reactions are due to active ingredients, excipients have long been overlooked as a causative factor. Encapsulated products are recognized worldwide as the purest form of oral supplements. By only manufacturing encapsulated products, Dr. Vera's pure innovation provides you with the opportunity to offer your patients a unique range of Australian products. We provide products that are innovative, pure, and hypoallergenic with maximized absorption. It is Dr. Vera's pure innovation's priority to minimize added ingredients whenever possible and eliminate any constituents that are potentially toxic or allergenic or interfere with the absorption of the active ingredients. This is why Dr. Vera's pure innovation developed a 5-step code of practice to ensure that we provide the highest standard of nutritional supplements in the Australasian marketplace. The first step in the DVPI code of practice is purity. All products in the Dr. Vera's pure innovation range are carefully manufactured to ensure that they meet stringent criteria for purity. These criteria are hypoallergenic formulations, pure ingredients, and maximized absorption. To ensure that a formula is as hypoallergenic as possible, it is essential to look at the excipients in the product. Excipients can often be misrepresented. Because we only use capsules, Dr. Vera's pure innovation can minimize and carefully select excipients that are free from gluten, wheat, corn, lactose, dairy, sugar, yeast, and other potentially allergenic ingredients. Mr. Henry Oseki, a nutritional biochemist, explains the role of excipients in nutritional supplements.
Excipients are actually used in formulation of actual tablets to make them more acceptable for people to take them. For instance, they use in the manufacturing of magnesium stearate to it acts as a lubricant, so the powder go through the machines much easier. You might add glidins like silica in there to make the powder flow through the system, so you could actually make the tablet in the right weight. You may coat the actual tablet with a polymer so as to keep its ingredient safe from oxygen or moisture, or you may even colour the actual tablet to prevent it from being oxidized with light or exposing the active ingredients in light. They are all used to improve the aesthetics of the actual tablet so the actual patient will comply and use it. They're also used to make sure that you distribute the active ingredient through the tablet uniformly, and that's where you need glidins to get the proper mixtures. And magnesium stearate, well, mainly that's only put in there to make it go through the machine more effectively. It's not any benefit to the patient at all.
It is important to recognize that active ingredients can also contain hidden carriers that are not required to be claimed on the label. Dr. Vera's pure innovation carefully selects all raw materials to ensure that the active ingredients are in their purest form.
And also some nutrients, like some enzymes, can be on a base of maltodextrin as well to actually carry the active ingredient in it. But it's not usually listed on the actual label. And we have to be very careful here, particularly when you're manufacturing. When we say for instance, if we take bromine, we say 500 milligrams of bromine. Does that mean 500 milligrams of the excipient plus the active, or is it the active? And in the cheaper varieties of product, it means both the active and the excipient. So you may have 50 milligrams of the active and 450 milligrams of the excipient. So you have to make sure when you're getting a tablet that it has, when it says 50 milligrams or something, it is the actual active in it.
Not only do we carefully select our excipients to be hypoallergenic, we are also extremely concerned about the number of potentially toxic excipients found in many supplements. Excipients such as titanium dioxide, sodium lauryl sulfate, propylene glycol, tartaric acid, iron oxide, and talc are commonly used in the process of manufacturing tablets and, to a lesser extent, encapsulated products. Because we only use two non-harmful excipients, glycine and silica, we can assure that our products contain no artificial colours, preservatives, flavours, sweeteners or other potentially toxic substances.
The titanium dioxide is another excipient that people use to actually colour their tablets. It's actually a whitening agent. But actually the ones that I'm worried about more than titanium and even iron is the aluminium one. The ones they give you the very blue colours, some of the black colours and yellow colours and things of that nature. And I think taking aluminium in the long run is not very good, conducive to, if you're taking a lot of tablets, to health.
There are many factors that may interfere with the absorption and bioavailability of a product, such as combining nutrients that antagonise each other and compete for absorption. Nutrients in Dr. Vera's Pure Innovation formulas are carefully selected for their synergism and bioavailability.
Magnesium stearate is of interest because it's hydrophobic and it may actually coat the active ingredient, and there is some suggestion that it may prevent absorption of some nutrients, particularly in individuals who have gastrointestinal type problems. Magnesium stearate has the potential of adversely affecting bioavailability and solubility of the active ingredient.
The second step in the DVPI Code of Practice is research formulations. Purity is one thing, but on its own it's not enough. Dr. Vera's Pure Innovation formulations also have to deliver efficacy equal to and above competitor products. This has been achieved by using the combined ability of Australian researchers dedicated to bringing innovation and efficacy to this market. Built on a reputation of research and integrity, Dr. Vera's Pure Innovation upholds these values which form the foundation of the range. The third step in the DVPI Code of Practice is manufacturing partnership. Dr. Vera's Pure Innovation has aligned with our manufacturers, working together in partnerships to ensure that the purity and low allergy criteria are maximised in every formulation. This manufacturing process is meticulously followed from raw material selection to release for sale. Products are made to exact specifications and raw materials are thoroughly tested and carefully selected to ensure optimum quality and purity. The importance of GMP, or good manufacturing practice, is extremely high when producing nutritional supplements. Dr. Vera's Pure Innovation endeavour to surpass GMP standards, setting the standard for the integrative medicine industry. The Therapeutic Goods Association also have stringent guidelines to which Dr. Vera's Pure Innovation adheres to ensure the utmost safety of product. We invited Ian Chant, an expert in quality assurance and manufacturing in the pharmaceutical industry, to talk about quality assurance.
In everything that we do, whether it's purchasing a raw material, developing a formulation, or considering, say for instance, the shelf life of a product, we look at four things. The first thing is about safety. We make sure that everything we do, raw material, formula, produces a safe product. The next thing is identity. This means that the raw materials that we use, for instance, in the products have to be positively identified against primary reference standard. That means that what's in the product, what's on the label, is exactly what's in the product. The next thing is purity. Purity means that you're looking at contaminants, potential issues in the products. The last thing is looking at the strength, and that strength is of the active component needs to be present not only from the day it's manufactured but right up to the day that the product is going to expire. So we do studies to ensure that the product has the correct strength all the way through the life of its product. And during encapsulation, for instance, we're checking the uniformity of the dose. So we're consistently taking samples from the product as it's manufactured and measuring the weight variation, for instance. We're measuring how quickly the product dissolves. With all those factors in mind, you can be assured that your patient is getting exactly the product that you prescribe to them.
This relationship allows for total quality control, ensuring only the purest, most hypoallergenic and innovative products are produced. The fourth